Good evening, everyone. Thank you for joining. At the request of Dr. Abbas, I greatly appreciate you. So this evening, I'd like to talk to you briefly about daycare health and transport and what it is we are doing here in Ghana and how you can participate. I quickly want to share my screen, so please let me know by a message in the chat box if you could see it. Dr. Abbas, can you see my screen? Okay, wonderful.
Yes, please, I can see it.
Okay, wonderful.
I can see it.
So yes, everyone, I am Marvin Walker. I am the founder and CEO of Daycare Health and Transport, a subsidiary of Run Free Technology Incorporated from the United States. We have expanded our service offerings into Africa as of 2019. First came in the country in 2018 and brought daycare here as a support system to the lack of ambulance service here in the Ghana market. When I came in 2018, the country at the time had only had 16 ambulances, and it was made aware to us by a medical facility that we partnered with here that wanted this as a solution. Unfortunately, that working relationship did not work out, but we decided to stay in Ghana since the need was so important. So what daycare, health, and transport is we are a medical rideshare, on-demand staffing platform, and a go-to tool for individuals utilizing and seeking for e-health services. What makes us different is that all of our providers and transport individuals have a background in healthcare. So we have nurses, doctors, and certified transport specialists who transport our patients to and from their doctor's appointment. And when we hire drivers who don't have a medical background, we take them to a 4-week training where we teach them CPR, how to use the AED machine, how to lift patients if they've fallen, and various basic skills that one should have when working in healthcare. Our purpose, our primary goal is to make access to care fast, safe, and affordable for Ghanaians all across sub-Saharan Africa, whether they live in a rural community or they live in a metropolis like Accra. We do put an emphasis on reducing infant and maternal mortality because a lot of women die, pre and postnatal, and children as well because of the lack of access to care. And we hope that our solution helps reduce that significantly. Now, daycare provides these services, again, to everyone in the community that are looking for access to healthcare. So we work with medical facilities, pharmacies, durable medical equipment suppliers to connect them with pregnant mothers, seniors, and persons with limited mobility or individuals who have chronic care conditions. One of the many ways that individuals could access our service and connect with doctors, pharmacies, and medical transportation is by downloading our mobile application off of the Google Play or the App Store, and that's Daycare, care with a K, not a C. We also have our booking kiosks that we put at medical facilities that we partner with, so that when a patient has finished seeing their medical doctor, they now are headed home. Instead of taking Uber, Bolt, Yango, they could take one of our daycare rides. They could either walk up to the booking kiosk themselves if they are not intimidated by technology and know how to use a tablet, or the administrator at the front desk could use the kiosk to request a ride for those who are older in age and don't know how to use technology as much. Now, when we place this at a medical facility, should you be on the call and you have a medical facility. You earn a commission off of every ride that is taken from your facility to back home. So with that revenue, some of our partners use it to, rehab and uplift their medical facility, purchase medical supplies, or do something special for their staff or their patients. This is an example of our floor model kiosk sitting in the lobby of Silver Star Towers in Airport City, with which we are contracted. Another way that individuals could access our service if they don't have a smartphone and they're working with a YAM phone, they could simply call our call center here in Accra, and then one of our contact center staff will find out what services they need, when they need that service, whether it's immediately or at a later date, and they will schedule it. Then they will send a message, both an email and a text message to that patient, letting them know who the medical provider that will come to see them, or the transport specialist that will come and pick them up. And that patient waits at their home or at work, and we either send our doctors or our nurses to their work or home to pick them up and treat them, or we pick them up and we take them to the doctor's office, whichever they prefer or they specify when they're getting their request set up. And then our providers just either go and pick them up, as I mentioned, or meet them at the place that they specify. Now, our capabilities are, through our platform, we offer medical transport, pharmacy delivery from pharmacies who register on our platform as a way to get their products in front of our clients, since we specialize in health services. Medical supplies for hospitals, private hospitals, doctors that have their private practices. We have a partnership with Medline, where we bring quality products at an affordable rate and not cheap product that comes from China that breaks and you find yourself having to repurchase them every 30 days or 60 days or however long they last. In the States, we do COVID-19 vaccine deliveries, and then we do specimens delivery, pick it up and take it to labs to get it tested as a mode of convenience for patients so they don't have to miss a day at work. We'll meet them at their work, pick up a urine, fecal matter sample, draw their blood, and then take it to the lab, MDS, Lancet, whoever they would like it to get tested at. And then when those specimens have been tested, we then pick them up and take them to the medical doctor so that they could give their assessment to the patient of what they have discovered. In addition to that, I said we provide e-health services where we do chronic care management, transitional care management for patients who had surgery, been sent home, and they need wound treatment or anything at home. And remote patient monitoring, where we monitor patients' blood, heart rate, pulse, weight, all of that stuff. And then, of course, doctors can connect with our patients and provide telehealth services. Now, when we do our vaccine delivery or specimens, we do it in our stone cold freezer, which monitors the temperature and keeps it at the perfect temperature that is prescribed so that they don't spoil or go bad. And we would like to bring these into Ghana as well, but right now we only utilize them in the United States. What makes daycare different is, as I mentioned before, all of our certified transport specialists have to go through a training program and be certified to transport patients. So they're not getting just a taxi driver, a boat driver, that if they have a wound, they can't treat it. They don't have a first aid kit in their car, basic life support kit, which all of our vehicles have. If it's a vehicle owned by a driver who comes to work with us, we still provide him with that. Our providers will also be uniformed so that patients always know that they are a daycare provider. They will either be in a medical doctor coat, they will have a Lacoste if they're a driver, And if they're a nurse, they will be in scrubs, which lets the patient know this is a healthcare professional. In all of our vehicles, we carry a car seat. So if parents are riding with children under the age of 7, we protect the most valuable cargo and precious, which is the children. We test our providers for COVID, hepatitis, TB, HIV, since some of them will be connecting with patients, particularly our nurses, if they're going and working in the home for long periods of time. We do those things to make the client feel safe. We don't use any vehicles older than 10 years, so you won't see any small donor tires on our vehicles that our providers are provided with. They do daily pre-trip and vehicle inspections to make sure that the vehicles are running optimally. And in the States, we have dual-facing dash cameras, and we do intend to bring them here. The types of vehicles that we currently use are the compact cars, the standard cars, and we want to introduce the wheelchair vans into the Ghanaian markets. And of course, we have our ambulances. We're not bringing in any more at the time until we have buy-in from multiple facilities. When I first came, I bought 30 ambulances into the country, and let's just say that they weren't received well and time and money was wasted. So once we have more medical facilities that come in, we can easily increase the number of ambulances that we provide. But right now, we're just doing non-medical transport in the compact and the standard vehicles, just like Uber. Because we found out that even if you have ambulances and the people don't have money to pay for it, it's a mute cause. And then we find out that most Ghanaians they typically jump in a taxi to get to their medical appointment, or they use private car if they're sick or need care and they can afford that. So we make sure our price is competitive as Uber, Bolt, or taxi. We have a team of health professionals, both from the US and here in Ghana. We're working with Dr. Bass now. We brought him on, but our team right now, our US team, and then we recruit the unemployed nurses here in Ghana. We train them. And when they work for us, if they decide they want to go work in the US, our 2 nurses from the state, Adrian Crowder, who's a physician assistant, and Teresa Graves, who's a registered nurse, they come here to Ghana and they help our nurses prepare for their NCLEX, their IELTS, or their certified nursing assistant exam in the States. And then we have Samuel, who are our operations manager and our chief nursing officer. And then our marketing officer in America is Tanya Abreu. She's owned over 28 hospitals herself, worked with them, and then she's done marketing for over 250. So she helps us get our partnerships with the medical facilities in the US, where we could place our nurses who transfer to the US in a hospital to work, or either a long-term care facility. That is a high-level overview of the daycare service and the platform. And with our app, we intend to improve healthcare and access to it in Ghana. And we are looking for collaborators like yourselves, whether you own a pharmacy, whether you own a hospital, or whether you're a medical doctor and you want to provide care and make additional income by making your services available to our customers. You could register on the daycare app, and you could use this as a revenue stream, a revenue generator, and an additional revenue stream. So this is our mobile application interface. And when our customers come on, if they want to look for a doctor, they could select a doctor here. Now, the great thing about our app is if you're in Accra, you could treat patients or have a virtual consultation, whether they're in Accra or they are somewhere else. Like I demonstrated with Dr. Abbas, he's out there. Dr. Abbas, where's the area you're at again? How do you spell it? I would like to show them that even though I'm here in Accra, I could request for your services and send you to treat someone right there in, there you go, right here, Ayakuma. So I'm looking for a doctor there, and as I go there, I could see that oh, that's not Ayakuma. I'm so sorry, guys. Well, text it in the chat box, please, Dr. Bass, so I can show the group. But for now, let's say I'm looking for a nurse here in Accra. I could select a nurse, and then it will show me all of the nurses that are within close proximity to my area. And then you could scroll up and see all of the nurses. I could also click on this tab right here and identify the nurses who are close to me within proximity, right? So close the app and you see all of our providers based on the location on where they are at. So those are the two ways that you can find a provider, and based on your location, you select the one who is closest to you, either by the 5-star rating that they've received from other patients, or you select them based on closest proximity to you is what a patient will do. And just as the same as you can do that, you could use our app the same way you use it, Uber or Bolt, to request for transportation. And our providers will log in onto their mobile app. And once a request come in, they can accept that request based on the customer's need to get to their medical appointment. Let me open it up. The network is a bit slow. So if you're a provider, you could make yourself and your services available by logging into the app or registering if you haven't registered. Yeah. Or you could register your pharmacy, and get access to our customers so that they could purchase your products and have it delivered to their doorstep because they're not feeling well. I'm sorry, MarvinQCWI.com, okay. And if you have a medical facility, our products, like our booking kiosk, again, could be stationed at your facility, and you earn a commission from those trips that are taken from your facility home. In addition, if you introduce our platform to your medical doctors that work at your facility, and every time they do a job on the daycare platform when they're not working at your facility and they want to make some extra revenue, you will earn a commission as well because you referred those doctors to the platform. So here, I will put that I want to go to 37 Military Hospital, and I'm a patient and I'm needing medical transport, and I simply click the request button. Our providers have to agree that they're practicing COVID-19 protocols. And just like that, the provider is requested, and they can now go and provide the services to our customers by accepting that request. You see how fast it was, and then they just get there, pick up the patient, and take the patient to their medical appointment. The patient, when they request it in the app, they see the provider at the bottom that's coming to get them. They could call the provider, they could send them a text message, or they could additionally share their trip with their family members, their loved ones, so that they could see where in the transportation process they are headed to their medical appointment. And that is how the app works when booking a request for a transport need, right? So I'm going to cancel this and then show you the same thing, how it works when you make a request for medical supplies from the store.
Marvin,
Yes.
Marvin, can you share your screen? It looks like they missed out on the demonstration.
Oh, the screen stopped sharing. Okay, let me share it again. So sorry. I didn't, when that other person entered the room and stopped sharing. Okay, can you guys see my screen now?
They can see it now, yeah.
Okay. So another demonstration I want to do is when they order something from the pharmacy. So when they go here to our store, they connect with all stores that are registered on our platform, just the same way you use Glovo to order food. You could use the daycare app to order the medications. So when you register your pharmacy or your medical supplies, patients will see your store close to them, and then they could go into that store and they could then purchase items that you have available for purchase. Then they could pay for those items via mobile money, via bank card, or via cash, mobile money, or bank card. They add the items to their to their cart. If they have a prescription, they attach it. If not, they move on. And then they could leave for the store, whether they're doing delivery or they're doing takeaway. They could also leave a voice recording for the provider that's picking up their medication to deliver it to their address. You know, we don't have addresses here in Ghana on every home. So they may say, hey, I'm at SDA Junction, right across from the C4C Medical Center. They can leave a voice recording. And then just like that, they then make their payment, and then the store will be notified that an order has come in, and then they could then go ahead and, oh, let me finish. Okay, so saying here, the customer see that they've placed the order, and then here, I should be seeing, it sees here the order came in. The store will then look at the order, and then they will confirm or decline whether or not they have it. For this example, we're gonna confirm it. So now the store has accepted the order for this Sudafed, and then the customer is updated every step of the way, so they don't have to call back your store and say, hello, mi pacho, where's the dispatch at? Is my order been shipped yet? Is it on the way? They're updated every step of the way there. Once the store has picked the order off the shelf, put it in a bag, they then can assign a delivery driver. And then it says here, I didn't close that other trip. Let me close out this trip. Okay, it's done now. So now, once they assign a provider, the provider will then get the notification, and then they accept it. And again, the customer on their app is notified that a driver has now accepted the order. So they don't have to, again, call the shop and say, where's my order? They see here that it's been accepted by a delivery driver, and they are coming to pick it. The store as well knows which delivery driver is coming to pick up the order. And then the driver, once they get to the store, the dispatch, whether they're using a motor or a car, will get there, and then they will pick up the item. And then once they get there, they confirm that they have picked up the right item. And then they have an option to take a picture so that the customer can see that they have the right item. So they take a picture of the Sudafed, and then they save it as proof that they picked up the correct order. And then once they get there, they make the delivery of the order. The customer will come out and get it. They confirm that they've given it to the right person. And then over here, you see the customer is made aware your order has been delivered. Now, a key thing is they could also call the dispatch rider or the transport delivery driver right here from inside of the app, so that they could know where they are, if anything. But again, now the driver has delivered, they accept that they received it, And just like that, the store has completed an order. They have made money on a customer that normally would not have discovered their store, but because they registered on our app, they did. And then the provider will rate the customer. Not only do the customer get to rate our providers, but the providers get to rate, especially when our nurses are going to provide home care. If somebody is being rude, aggressive, we want to know these things so that we can ban those customers from the mobile app. So it's a two-way rating system. We rate the customers as well as they rate our providers. So it's the same system when they order for specimens to get them delivered to the labs. But you see, they could request a midwife, they could request a physiotherapist, they could request doctors. So we have consolidated all of the healthcare services. They could even get a dentist and do consultation, or have the dentist come do a cleaning at their home, whatever they prefer. So we consolidated the healthcare services, and we would be very excited to have your facility, your pharmacy, your medical lab, or you as a provider to cater to our clients that are in need of your specialties when they are having a medical condition. And this is a great service to have because COVID-19 has taught Ghanaians that when major impacts to people's health like COVID-19 happens, a lot of people don't want to go and sit in a crowded emergency room with sick people and expose themselves to risk, or they just don't want to sit in long queues. And in the comfort of people's homes, guess what? There are no queues in their homes, so they like to get service in their homes now. And we have seen an increase in deliveries being sent to people's homes once we went on quarantine. So you, as a medical facility, as a medical doctor, as a nurse, can make the access to your clients convenient, safe, affordable, and you can make additional income by making your services available. That is the end of the presentation. Does anyone have any questions for me as I am done demonstrating the app? Don't be shy. Please free to ask any questions that you may have.
We came late, but what they said is
Excuse me. Someone saying something.
All right, I think it was a great presentation. My question is, with I don't know if I didn't hear it right, but is there any monthly subscriptions to be paid or anything of that sort? Or is there
is no monthly subscription. We just take a commission from each provider that is on the platform for connecting you to more opportunities. So for example, based on your specialties and the rate for the consultancy fee, there will be a 30% commission paid to us for facilitating the transaction through our platform. So let's just hypothetically say you do a consultation for 100 CDs, you will keep 70 and the platform will get 30.
Marvin.
All right.
Yeah.
So the question was asked by a pharmacist. Can you address it specifically with regards to pharmacies? Let's say somebody decides to onboard his pharmacy.
Yeah. So what's the question?
He was asking about subscription.
Oh, there's no subscription. It's free to advertise your pharmacy on our app. There's no subscription charge. Any other questions?
Albert, do you have a follow-up question?
Okay, go ahead.
No,
Okay.
please. No, please.
Okay, Harry, kindly carry on.
Okay. Good evening. So that was an awesome presentation. I wanted to ask if you spoke about people requesting for labs to be done for them. And then that means that a med scientist would have to go to the patient or the client's house to take the sample. And I wanted to find out, how will you be able to know whether this sample is supposed to go to this particular facility, or is it that there are a list of facilities that are on your app, like MDS, Lancet, and the rest, that are there for the client to actually pick from?
Yes, the client will pick from the labs that are advertised on our platform, and then they will say, oh, I want you to send it here to get tested. And then they will put the specimens to get tested the same way they would make a purchase from the pharmacy. And our providers will take it there because it will specify which which lab they want to take into.
Okay, but how about facilities that are not on your app? What if the client wants the sample taken to a different facility, let's say a government facility and not a private facility?
If they wanted to go to, yes, they could specify even if they're not registered on our app, but we encourage them because the ones that are registered on our platform, we want to help them make additional revenue and introduce them to new customers. But the client that's using the service is free to specify specifically if they wanted to go to another one. They're welcome to do that as well. They're not limited, but we encourage them to use the ones on our platform because they are our partners.
Oh, okay, that's fine. Thank you so much.
You're welcome. Does anyone else have another excellent question? These are some very good questions. Hello, anyone else? Anyone else?
Hi, I have a question. I may have missed that part of the presentation, but are your services available outside Accra?
Yes, so
right
now we are in Cape Coast. We have just hired several people in Cape Coast as far as our internal team so that we can deploy in Cape Coast. We are setting up our office in Kumasi. We've been working with nurses out there. And then also we have several facilities that have joined in Tamale this week. So those are the areas that we are at now, but we would like to make our services available in all 16 regions. We recently signed a contract with a company here, a major corporation that has 500 employees in all 16 regions and over 4 million customers in Ghana. And they need us to be in all regions so that all of their employees and their customers can benefit from the service. So we will eventually be in all 16 regions. That's why Dr. Abbas is setting up these meetings so that we get introduced the service to you guys. And then now you could make yourself available to our clients, the 4 million customers and the 500 employees of this one corporation that has just partnered up to be the care partner.
Thank you.
You're welcome, sir.
So, Marvin, there's a question in the text bottom.
Yeah, I'm looking at it right now.
So,
Are you linked to specific pharmacies? No, right now we are looking to work with as many pharmacies as possible, but we don't have any specific pharmacies that we have affiliations with.
Hello, Victor. How are you? And the news for me?
Any other questions?
I saw her in the flesh. All right, man.
Great question, Frida.
Done. I would rather do it myself. Sorry, man. Make it up. Do your job and find Lillian.
All right, well, if you guys have any other future questions, feel free to communicate it to Dr. Abbas, and I would be make myself available to address them and get the answers to you as quickly as possible. I know it's late and you guys have took time away from your families. You've been working hard all day. So I thank you very much for making time to hop on this call. You all have a wonderful evening and a blessed night.
So we'll send out the link to the app so everyone here can have access and have a feel of how it looks like. And then we'll take it from there. Thank you.
Okay, thank you all. Bye-bye.
Doesn't get mad when he finds out what happened.